What should patients look for in before and after photos? I think the first thing is looking at the number of results. Just a few photographs on a website is concerning. You want to see that they've been able to establish consistent results with variable anatomy in different patients. Try to identify patients with similar anatomy to your own, whether that be the pre-existing appearance of the nose or of other facial features, to make sure that they were able to establish harmony. At a minimum, look at the front view. Look at the oblique view from one angle, look from the side, look from the base. If they have the views from above, that can be helpful as well. Ideally, the nose should flow well from one part of the nose to another, from the bridge or the dorsum to the tip to the side walls that we call the ala. There shouldn't be sharp shadows separating those. They should all flow well together and look natural. When the nose is pinched, you end up with shadows along the tip of the nose that can be, number one, not very pleasing cosmetically, but also the sign of progressive pinching and collapse that can lead to functional problems. Obviously, asymmetries, scarring are things that are best avoided. So while it's impossible to get the nose completely straight in some patients, it should be so minimally noticeable that only close inspection reveals that. Try to avoid results that look consistently the same. The same nose on everybody is not going to fit every face. There's unique anatomy to the rest of the face, and the nose should match that accordingly. Ask about how far the results are. A 1-month result looks very different at 1 year. Ideally, you want to see photographs that are at well past 6 months, ideally 12 months or beyond, to show long-term results. So questions to ask when reviewing the before and afters are, do you have any patients with anatomy similar to mine? Are these results early or long-term? What changes were realistic for this patient? What would be different in my case? Rhinoplasty involves judgment. And so the long-term results in the before and after photographs should demonstrate to you what your surgeon's aesthetic is, what they think looks good. And so you may have a different opinion. And if you don't see that aesthetic on the before and after results, then you need to ask to see results that are more similar to what you're looking for. A lot of this is just opinion. What I think looks good is not necessarily a good result if you don't think it looks good. So before and after should show judgment and aesthetic opinion, basically, not just the technical ability.